First, place the suture and get into the start position. With the long part of the suture in your left hand, the short piece to the right. With your left hand, pinch the suture between your thumb and index finger. Now take the suture on the right and place it over the suture, which is positioned over your index finger. As you are doing this, you will have to raise your thumb. Once the cross is made, hold it in place with your thumb and do not let go. Now go under and grab the suture end. The suture material is under the tissue. Hold in this position. Now raise your thumb and place the suture across your index finger. Make an identical cross to the first cross. Now replace your thumb holding the crosses and do not let go. Now with your needle holders, you need to pass these where your index finger is. So slowly withdraw your finger to allow the forceps through and grasp the tail. Now with the needle holders, pull the suture back through. This is through the center of the two loops. Once pulled through, you then send the suture the same direction as it was before. The end result is two loops of suture with the suture entwined. So, when the entwined suture is pulled from both ends, both loops tighten and lock. I refer to this as a Miller knot, but opinions vary. I refer to a modified Miller where there are two loops, but the suture is only entwined around one loop. Some call the knot we have made a strangulating knot and others a modified Miller knot. There is a lot of confusion of what is called, but this is the best locking knot, despite what it is truly called. As this is a dog castrate, we slide the Miller knot into the crush bed and then tighten. Occasionally at the back of the Miller, the two loops can separate. You can avoid this by pulling up vertically on the Miller knot before tightening. Usually follow with 5 singles. If you only place 2 or 3 and the suture is of poor quality PGA, you have the risk these will unravel. We will reverse to the first person, so left on the video is your left. So firstly get yourself in the start position. Longer piece of suture on your left side, shorter on the right. With your left hand place the suture over your index finger and pinch it with your thumb. Now take the piece of suture on the right and position the suture on the left side, over the left index, so it forms a cross. Now place your thumb on the cross and keep holding it. You need to keep holding the cross with the thumb. Where your index finger is, it is in the center of one loop at the moment, and we are about to add another loop. Keep your left hand close to the tissue we are ligating. With the needle holders, we go under the tissue to grab the shorter piece and then pull this piece, so it forms a second loop around the structure we are ligating. With the needle holders grasping the end of the suture, we pull this under the tissue and then around, over the index finger, forming as second identical cross, and again hold this position with your thumb. Now with the needle holders, we are going to go through the center of the two loops, basically where the index finger is. So try to slowly withdraw your index finger and send the needle holders through, and then grasp the tail as shown. Once we have hold of the tail, with the needle holders, we pull the tail out between the loops, and then position it in the direction way it was before. This has now formed the Miller, strangulating, or modified Miller knot, depending on who has told you its name. So, a new Miller knot. Firstly, get into position, long suture on the right, left shorter piece on the left. With your left hand, have the suture draped over your index and your thumb above, ready to hold crosses. Take the suture from the right, pass it over the index finger to make the cross. Hold this cross with your thumb. Now go under the tissue and grasp the end of suture. Remember to keep your left hand close to the tissue we are ligating. We now place the suture over the index finger, making an identical cross to first. Hold this in place with your thumb. Slide the needle holders through the two loops, where your index finger is. Grab the tail and pull it through. Once through, return the tail to the same direction. Now you have the completed Miller's knot. First, place the suture material around the ovarian pedicle. Now get yourself in the start position. The long piece is to the left, short piece to the right. On the left, hold the suture across your index finger, with your thumb ready to hold across. So take the suture from the right and cross it over the suture, which is over the index finger. Hold the cross in place with your thumb and never let go. Now we send the suture under the clamp and around the ovarian pedicle. We then continue it over the index finger, making a second identical cross, and this held in place by the thumb. Now with your needle holders, go through the center of both loops. Rasp the tail and pull the tail back towards you. And then once past the loops, the suture is sent in the direction it initially was. Suture is wrapped around the ovarian pedicle. The smallest piece of suture is on your right and the longest on the left. You need to hold the left side with the index finger and thumb. Here we can see the index finger has the suture material wrapped over it, with the thumb pinching the suture material. Now with the other piece, cross over the index finger, making a cross with the suture, holding this cross with the thumb. Now pass the suture under the clamp and around the ovarian pedicle. Now the suture forms a second cross, identical to the second. Now with the needle holders, we carefully go between the two loops, grab the tip. Pull the tip through the two loop and the once clear. The tip is positioned in the direction it started. Wrap the suture around the ovarian pedicle. Get into your start position with the suture across your index finger and thumb ready to hold any crosses. Now cross the suture end over your index finger and hold the cross with your finger. Wrap the suture under the clamp and as you go under the bottom of the clamp. Continue with the suture and add an identical cross over your index finger. Again, hold the two crosses with your thumb. Now with your needle holders, go through the center of the loops and grab the tail, all the tail through, and once through go back to the same position the tail was in. Wrap the suture round, your right side short piece of suture, left side long piece. Form the start position, suture over left hand, left index finger, with thumb holding the suture. Now with shorter piece, to the right. Cross this over the suture off the index finger. Make a X and hold in place with thumb. Now continue placing a round tissue under the clamp. As coming round, lift the thumb and make an identical X to the first, Hold in place with thumb and don't let go. Now use your needle holders. Go through the middle of the loops where your index finger is. Grab tail and pull tail, back through the loops, once out of the loops. Send the suture material in the same direction as when you picked it up. First, place suture material around the uterus. Now form the start position with the suture dripped over the left index finger, holding in place with the thumb. Now wrap round, going over the index finger, making a cross with the suture that is already there. Once cross made, hold in place with the thumb. Now grab the end of the suture and pull it around the uterus. Take it over the index finger, making an identical cross to the first, hold and place with your thumb. Now pass the needle holders through the center of the loops where the index finger is. Grasp tail of suture and pull it back through the loops, and then send it in the direction it initially was. With the two loops of the millers, it is worth checking at the back that they are side by side. To achieve this, once you have formed the millers, pull the strands vertically, and this will help to get them side by side. The other option is just to nudge them together with forceps. So, wrap the suture material around the tissue and get yourself into the start position with the suture running over your index finger. Now wrap the suture over your index finger, making a cross with the suture which is already there. Use your thumb to hold the cross, and then continue with the suture, wrapping it again around the tissue. Then make your second cross and hold it with your thumb. Pass your needle holders through the loops where your index finger is and grab the tail. Now pull the tail through, and then once through, send it in the same direction it was.